Welcome everyone to our quarterly meeting. Please be patient while we wait for a few minutes for everyone to join us. Thank you. Again, welcome everyone to Healthcare for All Minnesota's quarterly meeting. Just another minute while we wait for a few more people to join us, and then we'll get started. Thank you for your patience. Okay, everyone, we're going to go ahead and get started. Just a few things before we start. Again, welcome to our quarterly meeting. This meeting is being recorded. If you have any questions, please put those in the Q&A feature at the bottom in your toolbar. For technical questions, please put those in our chat. So questions for panelists in the Q&A, technical issues, put them in the chat. And with that, I'm going to hand it over to Ann Jones. Ann?
Good morning, everybody. My name is Ann Jones. I'm a registered nurse, retired, and working pretty hard on fixing how we pay for healthcare in Minnesota. And thank you for choosing to spend some time this morning with us to talk about the issue of health justice for all. Our presenters today you've heard from Judy, our administrative coordinator, Dr. Mark Brakke, our chair of our board for Healthcare for All Minnesota, Don Pilkinen, secretary treasurer for Healthcare for All Minnesota, Carol Engelhardt, who is chair of our fundraising events, and our Minnesota Health Plan Legislative Caucus leaders are our guests today, Senator Jen McEwen, Representative Liz Bolden, and Representative Liz Ryer. Our agenda includes a welcome from our board chair, a financial report from our treasurer, reports on results from the May 20th fundraising event, and then some time with our Minnesota Health Plan Legislative Caucus leaders, and then some information from Mark about the Medicare payment model that we're concerned about. Why do we care? I'll have some announcements at the toward the end, and a social media update from Judy. So let me go ahead and introduce Dr. Mark Brakke, chair of our board, for a welcome and some opening remarks.
Good morning, everybody. I hope everybody's morning coffee and tea was great. Thank you for joining us this morning and helping us to work on the problem of how do we fix the Minnesota and US healthcare mess. I need to comment a little bit on last week. Last week, Tuesday, May 24th, was a terrible day for Uvalde, Texas. An avoidable tragedy occurred, and we are all angry that this avoidable loss of life has occurred again. The refusal to acknowledge the reality of the problem and the obvious steps needed to improve gun safety remind me of the willful blindness of many elected officials to the U.S. healthcare crisis. It is truly an immoral and irrational situation. We must all be steadfast in our demand for rational legislation to improve gun safety, and we must be equally determined to stop the healthcare crisis, which harms millions and kills thousands every year. Fortunately, we have some good news for you today. Healthcare for All Minnesota is reaching more Minnesota voters, and we are having good progress in building a coalition of Minnesota organizations and legislators, which will bring the necessary pressure to bear in the legislature so we can achieve the goal of universal, comprehensive, and affordable healthcare. So without further ado, we will commence with the next step in this morning's program.
So next up is a treasurer's report from Don Pilkinen, who's Secretary, Treasurer, and Board Member of Healthcare for All Minnesota.
Yeah, thanks, Ann, and thanks, Mark, for your opening thoughtful comments. As reported at the March quarterly meeting, our activities are expanding in number and geography as we're heading into summer and fall, for which revenue will need to keep pace. The Legislative Caucus for the Minnesota Health Plan was launched in February, and their leaders are meeting with upwards of 20 representatives of organizations at a June 9th Health Justice Allies meeting to plan barnstorming events in several cities, which will need our help. Furthermore, in addition to tabling for the Minnesota Health Plan at Pride Fest in Minneapolis in June and Farm Fest in Redwood County, Southwest Minnesota in August, we've added networking with city council members on city resolutions for the Minnesota Health Plan at the League of Minnesota Cities annual conference in Duluth on June 22nd. And I just want to add that some of the volunteers at these events have out-of-pocket costs in addition to the money that's raised from donors. The League of Minnesota Cities event will be followed by 12 days of tabling at the State Fair in September. These two additional events come with 2 more booth fees. 2 events require liability insurance costs, and there's expenses for 2 new banners, more handouts, signs, and buttons. Meanwhile, all this continues to require ongoing work hours for our social media specialist, Carolyn Hankey, who is increasing traffic on Facebook and other of our social media platforms. There's fees for every action in Zoom for more meetings and webinars, and Administrator Judy Barton's excellent work in coordinating these activities with several committees. Carol Engelhardt and other tremendous volunteers have done their part to keep up with the expenses with the terrific and successful Spring Fundraiser on May 20th. And thanks to the individual and organization donors. For those who want to pitch in to keep going forward, you can easily make online tax-deductible donations to our 501c3 HCAM Education Foundation. Just click the donation button on the upper right corner of our website's homepage that connects you to the contribution page. If you prefer donating by check, you can get a tax deduction by writing your check to the HCAM Education Foundation and sending it to HCAM. For the work that lies ahead in 2022, thank you to those who have chosen to make a donation of any size. Everything helps. And thanks again.
Okay, Carol, would you like to turn on your video and give us a report from the May 20th fundraiser?
Yes. Well, I'm Carol Engelhardt, and first, before we even talk about May 20th, I'm going to give everybody here a challenge. Can you either click the $5 or $25 button today during the meeting and donate? Rather than just thinking of one event, every time we come together, let's talk about what the Progressive Democrats of America do during their meeting. What it does is a small amount shows we care, that we're passionate about moving this forward, getting the activism that we can, and it gives us encouragement. So further than that, we'll see what happens at the end with my pitch and adding on to Don's, but let's talk about May 20th. May 20th was an amazing event because we got together for the first time and were able to visit and network, have live jazz, food trucks, silent auction items, raffle tickets, and the Canadian nurse and doctor presentation, which turned out excellently. I really want to give a shout out to people that helped. Judy Barton worked tirelessly right along with us, helping set things up, coming to my house. Linda Gridley, Jenny Jordan, Ann Jones, Cheryl Quick, Greg Flair, Ken Engelhardt, and my neighbor, Max Santiago, who has Jazz Central Studio. He's fully committed to our cause and volunteered to have his musician, Javier, and himself play jazz, and that was just amazing. Our unions really got behind us. They gave us large grants for this, and we want to give them a shout out. AM 950 Progressive Radio, they were amazing. We did pay them some, but they gave us a lot more in free. Even if we didn't get huge numbers, the biggest way we got people was calling, getting on the phone and calling, and personal connection and emailing, even in some of our own email newsletters, Facebook, to present it. But we got our name out there. We got interviewed twice, and it was incredible because they had a real clear message of what we were about and what we wanted to do in Minnesota. So we want to do that. And I want you to look at our donors because these are people that got behind us. There was a lot of hard work put into this. And these groups either had an experience or like Greg and Cheryl, they were our technical people and we're right there. And people donated items or their time. And then you look at Corazon Gift Shop by Longfellow Grill. Longfellow Grill. All the major grocery stores in the Twin Cities, Kowalski's, Lenz and Byerly's, Cub, they all donated pretty good amounts. Mississippi Market. And then we look at Start Lining of Cable. If you want to stay someplace in Wisconsin, that's a retired doctor that's fully committed to single payer, and she donated 2 nights at her lodge. And then, of course, the whole University Club of St. Paul and all their businesses, they put up some things, and that was great. Urban Forager, Vikings football, Twins baseball. We have, then you look at Farmer's Kitchen and Bar and Jones and Judy Barton. You look at all those donors and sponsors, and it's pretty amazing. So going forward, first of all, we made over $8,000. We even had some money come in afterwards, like another donation to stay at our cabin in the fall. Going forward, perhaps we'll do some smaller things. I don't know. There are other ways we can fundraise and network and meet together. This was my last event as a fundraising coordinator. I will be an assistant and help and volunteer at the state fair, but it's truly been a joy to do this. but with a lot of enthusiasm and hard work, you have to stay on task. As people closest to me and my husband and my children and my friends will tell you that you have to stay on task to get this done, to make sure all the moving pieces are going well. So, and just to let you know, I think we will have the presentation by the Canadian nurse and doctor up in a few weeks. What we don't like to do is spoil it for the people that came live and think, well, I paid, I went, and then you put it up 2 days later. So it will be up there, and then we can share it with others and tell them about it, because it was an amazing presentation. They were spot on when the doctor said, I just have to ask my patients, how are you feeling today? I don't have to ask them, how are they going to pay or worry about that. Then the nurse said, if you want to get this passed, you need to vote Democrat. So they were very aware of our politics in the United States. So I want to shout out to everybody that helped, and it's been an amazing journey. And I will still be with you in the fight, but not as an event coordinator or fundraiser. Thank you.
Okay, thank you, Carol. Next up, we are going to turn our meeting over to our members, our leaders of the Minnesota Health Plan Legislative Caucus, Senator Jen McEwen, Representative Liz Bolden, and Representative Liz Ryer. And Representative Liz Bolden is joining us from the hospital room of her son, I believe. So we really especially thank her for joining us this morning, and we'll let her decide how long she can stay. Thank you all.
Good morning. Can you hear me okay? Very good. All right. Well, good morning. I am Representative Liz Bolden. I represent District 25B, which is Northern Rochester, and really happy to be with you all this morning. And just in the lead up and discussion that you've already had this morning, it just is really impressive, the work that you all are doing. And so we, as the leaders of the MHP caucus, are just really happy to partner with you and be in this work together. And so, yes, I am, my background is a little wonky and I'm wearing a mask. I am, my son's in the hospital, so I'm in the back of his hospital room. So just note that I may have to jump off abruptly if his doctor team comes in, because we don't quite know when that will be. So if I do that, that's what's happening. So apologies. So I will just say, we were talking a little bit this morning about how all four of us as leaders of the MHP caucus are first term members. And so have just wrapped up our first term in the legislature. And one, I think that's notable that as leaders of this caucus, we are all first term members. We are all enthusiastic and excited and passionate about this issue and know that it's something that we have to get done. And so I think just sort of reflections about our first term, we can probably all share some of those, but there was a lot of very good work accomplished in the last 2 years. There was also a whole lot that should have been accomplished and wasn't. And so there's a whole lot of work left to be done. And this certainly, passing the Minnesota Health Plan is absolutely one of them. And you mentioned a little bit just the political landscape, and that absolutely is just a factor in our current divided legislature that, just is the reality that we are in, that makes things difficult. It's a challenge. And so, I think we can talk more about the future and how to change that landscape and what that looks like. But also, I will say I have over the last 2 years and certainly over the last year, I have felt a lot of momentum and increased enthusiasm and awareness of the Minnesota Health Plan, both awareness of what it is and awareness of the necessity of it, that this is the direction we need to go. Just for so many reasons. And, living in a global pandemic, certainly healthcare is on people's minds in a way that it maybe wasn't before. But, we don't need to be in a global pandemic to know that healthcare is a human right and everyone deserves access to quality, affordable healthcare. And our system that we have right now is broken. It does not work for too many people across our state. And there are things that we can do about that. I appreciate the comments previously about gun violence and sort of the willful blindness to solutions. And I think drawing that connection to our healthcare crisis is spot on, because there is that connection. It is willful blindness, it is immoral, and there are things that we can do to improve that, to be sure that everyone has the care that they need. So I am excited to be in this work. And I often say, for me, the antidote to despair is action. And so, to be in action in this work is really important to me. And to that end, we are going to continue to build that momentum and have plans for barnstorming events, or, events across the state through the summer and through the fall and beyond, to continue to connect with people across the state, to talk about the Minnesota Health Plan, and to have a bit of bi-directional information for us to share with people who are maybe not familiar with it, what it is, why it's important, why, how it would help them, and to hear from people across the state. What is your experience? How are you feeling? How is the healthcare system working or likely not working for you? And for us to get that information as well. And to continue to create that excitement and momentum and action, because it is going to take pressure from people all across the state on their elected officials to take action to get it done. And that is absolutely possible, but it takes all of us working together. And so again, which is why I'm excited to be here today and connected with all of you, because we can do hard things and we can do big things when we're working together. So happy to do that. So with that, I'll hand it off to my colleagues, but thank you again for having us today.
There's my mute button. Hello, I'll take it from here. You can get the succession of Liz voices before we turn it over to Senator McEwen. I'm Representative Liz Ryer. I represent Eagan House District 51B, which is the eastern side of Eagan. I will say first off that I am so appreciative of this group and the work you do. I'll echo Representative Bolden in just the impressiveness of the effort that has gone in, because it does all the things that you've talked about doing so far this morning take a ton of work. Anyone who's done those things knows how much goes into every piece of it. So I just want to honor and acknowledge that and thank you, because healthcare is a human right. Healthcare for everyone is a moral responsibility, and it's one where we're falling far short. So I want to just give my thoughts on this session. I mean, there have been some gains for the safety net as a whole, if you think about it that way. The healthcare is a fundamental piece, but in our current world, making sure that people have access to the care, attendance they need, help from people who help them stay at home, the ability to get their dental care, the ability to get mental health care. In our piecemeal world, we did make some marginal improvements, and those will help real people in their lives. And I am glad to see that. I am deeply frustrated that we have not been able to do more. Even considering a bill where Representative Bolden carried about doing analysis on the Minnesota Health Plan could not get through. And so just even the refusal to learn so that we can make informed decisions was off the table because of Republican resistance. So that's really what we are dealing with, is that maybe we'll have a special session. I hope we do, because there's so much good work teed up and ready to go through. And these pieces of legislation will help people, but it's still not the systemic change that we need to bring us together to stop healthcare from being a thing that costs lives because people can't get the care they need, that causes bankruptcy, that ruins quality of life at the very least. And I've lived through some of those things myself with my family, and I know how devastating it is when you don't have insurance. My mom had to declare bankruptcy because she couldn't pay my father's hospital bills after he passed. So, I mean, it's really a grim thing to live through. As you all know, you're all advocates for this. So we need urgency. I am in my first 2 years, I am just tired of saying, we'll take that up next session. I'm tired of hearing those words. I think the reason that you see 4 first termers here is because let's get going, people. That's the energy that we came in with, and that's what we want to accomplish. And so bringing that urgency, moving the Minnesota Health Plan forward. Representative Golden referred to the barnstorming. I think they're going to be great. I know that Dakota County is gearing up because there's a lot of people who are passionate about change here in Dakota County, which I represent. And then I have a personal policy interest that I just want to touch on before I turn it over, and that is the impact of the Minnesota Health Plan on seniors. Senator Marty refers to it as Medicare Plus, and as I've known but really experienced vividly when I got my brand new Medicare card this year, I'm lucky. I have employer-based coverage through my husband, so I didn't have to wade through the morass of all of the Med Sups or Medicare Advantage and all of the different things. But we know that seniors under the current Medicare system experience so many gaps. And I'll give you just a few pieces of information about what seniors are going through with their out-of-pocket expenses, not including the premiums. It's about 20% of the average Social Security benefit. It's increased almost 5% in 20 years compared to under 3% for the CPI overall. Retirees pay about 13% of their cost of care. And the cost of care for seniors, because of age and health conditions, goes up and up and up. So they can expect to be paying $14,000 a year compared to, in this low single digits for younger people. And then bankruptcy has doubled, more than doubled between 1999 and 2021. So if you think about having the Minnesota Health Plan for seniors, think about how transformational that is. We have so many seniors living on fixed incomes, worrying about how they're going to pay increasing property taxes, worrying about how they're going to keep food on the table, have transportation, all of the other needs in life, plus enjoy this phase of life where, maybe they're retired and able to just live their best life, but you can't do that when you're living under this threat of financial worry. So financial security, quality of life, Minnesota Health Plan can do that for seniors. So we need to be doing a lot. We need to be building community engagement. We need to keep events like this going, and I'm so grateful for you again. And we need political change, because the barrier to all of it is the GOP control. They won't even hear it. They won't even talk about it. We can't compromise on the details because they won't talk about any of it. And so political action right now is needed too. And so I would say, when you're out there talking to people, keeping the responsibility for inaction where it belongs, and telling the story about who's willing to move and what they could achieve. I know that all of us are in this together, and sure appreciate anything and everything that you do on that and all of your activities. So I'll leave it there and turn it over to Senator McEwen.
Thanks so much. Those are some tough acts to follow. I'm State Senator Jen McEwen. I represent Duluth in the Minnesota State Senate. Just sort of piggybacking off of what my colleagues, Representative Ryer and Representative Bolden, were saying in regard to this session. There's some really great insights there. I think I agree with everything that they've said, and I would share that from my position in the Senate in the minority, it does absolutely feel like we are at this sort of a logjam. I mean, the Republican-controlled Senate, it seems like they don't want to move on many fundamental things, including the Minnesota Health Plan, and there is this sort of and I perhaps it stems from just a deep distrust of any sort of government, which to me is community, right? It's a distrust of what we can do together, like in community. We come together, we can solve things together when we pool our resources through our tax dollars, and we can solve problems together. But there is a very strong current through the Republican Party that distrusts that wants to keep things very much individualized, very much controlled from the top down. There's also just a real digging in on refusing to sort of face the challenges that we're dealing with today. I mean, we saw that, we had the chair of the environmental committee on the Senate floor actually denying human-caused climate change exists. So that's the sort of like mentality that we're dealing with sometimes in the Senate, in particular, being controlled by the Republican caucus. And when it comes to healthcare, yeah, the refusal to even begin discussing these things is I think, where we're at right now. So it's extremely frustrating. And where I'm coming from politically in terms of my own ethical beliefs about what it means to pool our resources together through our tax dollars and sort of the interconnectedness of so many of these issues, I look to things like our failure to tax the billionaire class and our corporations and our wealthiest individuals appropriately. I think that many of our problems go back to that. We need to have the political courage to tax appropriately and to just like really switch gears here in a number of major ways. So we'll keep working on it. But in the positive angle is groups like this that are doing this movement work, the groundwork to set the table for change. And so I join my colleagues in thanking you for all of this really great work that you are doing. This is it. Like, this is the work that will make the change. And we're really excited to join with you in these barnstorming sessions. We're starting to talk about the details coming up, and all of us are running for re-election, as you know, this year. So we have that on the table as well. And I know both Representative Bolden is running for the Senate. So please support her in her election if you can. I'm so excited for her to join us in the Senate. That'll be amazing, but we need to get her across the finish line and support champions of the Minnesota Health Plan so that we have people in the Senate too who are really ready to fight for the Minnesota Health Plan. So please help Representative Bolden come in, join us in the Senate, and also Representative Ryer running for re-election, a champion in the House, and we need to keep those champions there and the people there who are really ready to do the work and to fight for this comprehensive healthcare as a right for every Minnesotan. So the election coming up is going to be a big deal. The barnstorming is going to be a big deal. I do want to encourage people to try to help us flip the Senate and to keep the House in DFL control. And I'm not actually approaching that from a partisan lens. I know that sounds extremely partisan, and I am a DFL member, but my impetus to ask for your help to have us keep the House and to flip the Senate to the DFL control is merely because there are many more DFLers. All of the members of our caucus thus far are DFLers. That is just how it happens to be. I would love to have our Republican colleagues join us. We are working toward that. Please keep pushing our Republican colleagues and Republican candidates to get on board with this. We've talked about this a number of times too. There's a many more conservative angle arguments about why the Minnesota Health Plan is the fiscally responsible thing to do. It's good for business. It's good for our entire state for a number of reasons, municipalities. So work those angles, please do, and encourage our Republican electeds to join us. But thus far, it is unfortunately only Democratic farmer labor candidates and electeds who are part of this work and this movement. I ask for your help as we move toward the election, making sure that the candidates that we're pushing forward are not only aware of the Minnesota Health Plan, but are pledging to join our caucus and to jump into the fight to make this a reality once we are in office next year. And that they want to be part of the movement building for it, that they really want to join in raising the awareness and the education throughout the state of what the promise of having the Minnesota Health Plan could mean for everyone in our state. And yeah, those are sort of my thoughts. And I think all of us would love to hear from the membership about ideas for places in the state where you think it would be a good idea to have one of these sessions. These are going to be sort of barnstorming, educational, gathering information, gathering stories from people, and improving the Minnesota Health Plan too. If people have ideas for how we can make adjustments as we work on it and move forward, that's wonderful. So we really want to have a lot of sense, really foster this sense of people of that this is our plan. We want this to be our plan going forward, and to people have a sense of this is ours together in community. So yeah, if you have some ideas about where we should go or some questions for us, thoughts, feedback, we'd love to hear it. Thanks so much for all of the work that you're doing.
This is Anne. I would like to invite attendees to put questions, if you have any, for our wonderful leaders of this Minnesota Health Plan project. Since we have them for a few more minutes, and we are a little bit ahead of schedule, so we have an opportunity if anyone would like to put a question in the Q&A section on your menu bar. Especially, I think, if you have ideas about where you think a good focus would be for us in the summer and fall.
And we have a couple questions coming in. First from Jim Hart, can you give us 8 to 10 Senate districts to focus on?
Liz, Representative Bolden, do you happen to have, I was just at my fundraiser last night, I can think of a couple. Representative Bolden's district.
25.
Yeah. What's the number?
25.
25.
I would also throw 24 in there, which is the other Rochester district. The candidate in that district is physician, Dr. Alita Barud, who absolutely is a supporter of MHP, and as a physician, certainly has firsthand experience. Also, I should have said in my introduction, I'm a registered nurse of 20 years, so I have firsthand experience of the healthcare system in that way too. So those are 2 districts that I would put on the list for sure.
I should have the numbers. Go ahead. Go ahead. Sorry, Representative. Oh, we can't. There.
I was thinking about the Moorhead area, especially with Representative Marquardt retiring. It's going to be hard to keep that one of our few outstate Democratic seats. So I think that plus Representative Keeler's district is she's so dynamic and would be such a great host that I think that the entire Northwest region would benefit from one up there. So that those districts would be a good place to focus.
I don't know numbers very well, Senator McEwen, but what do you happen to know what district Elise Mann is running in? Because I mean, she would be another one certainly who, as a physician and a supporter of MHP, and I believe that's a winnable district for her. I think that would be another one. I don't know the number though.
I know. I'm too new. I don't know all of the numbers of all.
I think we can certainly get back to you with a list though, I think.
That's what I was just going to say. I was just at a fundraiser last night, and actually the Senate DFL election effort has put together a pamphlet that does have the district numbers and the candidates highlighted and sort of a breakdown of what the focus is on the different districts that we need to do to actually flip the Senate. And so I'll ask for that, and I can pass it along to the leadership, and maybe they can post it out or send it out or something like that, if that would work.
Would you mind?
We have in the oh, sorry, Ann. We have in the chat that Dr. Mann is running in Senate District 50. And then Don Tuvison also said Woodbury SD 47 is another district that would be good to focus on from her perspective.
And I have a suggestion that we consider SD 33. Nancy McLean is running for the second time, running a strong campaign up there, and she is a strong supporter of a single payer financing for healthcare, Minnesota Health Plan.
Great. Thanks.
And
Let's move on to the next.
I was just going to add to up north, if there are some people up north who would be, Grant Housechild is running in the district that Senator Bach represents right now. He is a supporter of the Minnesota Health Plan, and yeah, he could use help too. It'll be really important for us to get that seat.
Next question. How is the Minnesota Health Plan funded? Is there anyone who wants to answer that question?
I have really studied up on that in the past, but I can give you a from my best of my recollection in my handy copy of the Minnesota Health Plan book. There's a combination of premiums. People would still pay premiums based on ability to pay. And that would be their only payment. So there wouldn't be getting nickel dimed or $1,000 after the fact. Probably it's proposed that we have it collected by Department of Revenue because they have such good mechanisms in place. There'd be a business payroll tax in place of the premiums or penalties that they're currently paying. And then we would use the existing federal and state funds that go to public programs. So those would be the main thing. And keep in mind that there would be things like we can't regulate under ERISA. So there, we'd have to work with that. But those are the big pieces.
Thank you, Senator Representative Breyer. Next question. Somebody's typing. I'm looking for a question. We have some comments. Recommend reading Healing Healthcare by John Marty. And that's available on the Minnesota Health Plan website. I'll put that in the chat.
It's the book, actually. I was just holding up the hard copy. So
yeah,
we're of like minds.
Sorry, I don't know why it stopped, but there we go. Dr. Hart says to let you all know that we will help with funding, canvassing, phoning, all that kind of stuff as we can. Judy Schultz put in the comments, as David Brooks said yesterday, this is so tribal. And so the GOP won't even consider the items we know are so important. This seems we need to work very hard on the elections, which yes. Dr. Hart said, and he is one of the people who wrote the original plan, sources of funds for the Minnesota Health Plan, individual premiums based on income level, business health tax, federal payments such as Medicare and Medicaid, outside donations to institutional providers. And I think that's all the questions. Yep. So that looks like all the questions in the chat or in the Q&A currently. Let me just look in the chat quick. Are you aware that the DFL Senior Caucus has an endorsing committee? This is an opportunity to get our message out. So are you also reaching out to all DFL candidates?
I just met with the DFL Senior Caucus, and one of the things that they ask in their screening is about support for single payer. So they strongly support it, and I'm really excited about that. And we'll continue to be looking for ways to bring them in, because they also are a group that will work and work. They become much more activist, less social, as the situation in our country and our state has gotten more fraught. And so I think that they'll be a great ally in this. And I think that you're raising a great point that we should all be pushing them and using, leveraging them and working with them to do more.
Great, thank you. Anne, do you have any other comments or questions?
I think not. We want to, if everyone is satisfied that they've gotten their opportunity to ask a question, we can go ahead and proceed with our agenda. And it's always good to be a little bit ahead of schedule. I want to thank our Minnesota Health Plan Legislative Caucus leaders for joining us this morning, and assure you that we are with you all the way in this movement and want to help with your elections going forward as well. So your choice to stay with us or sign off, because we know you're very busy.
Thank you, Anne.
Representative Bolden.
Thank
much,
you.
and Representative Breyer and Senator McEwen.
Thanks. Can I just say really quick, Anne, before I
Sure.
sign off? I was just going to, in reference to that last question or comment about, are you reaching out to all of the DFL candidates? I think that we will, do our best to reach out as a caucus, but we have so much on our plates right now in terms of our own elections, in terms of putting these barnstorming events together coming up too. We could use your help in that regard. So the candidates who are running in your local races, the House candidates, the Senate candidates, regardless of party, my ask to you today is to please contact them, urge them to get on board with the Minnesota Health Plan, find out if they are already on board, thank them if they are already helping and in the caucus. If they're not, ask them to join, ask them to learn about it. Just keep bringing it up. Keep bringing it up in forums, in meetings, in phone calls, in letters, however you can. And that will help us a lot with our efforts. Thanks.
We'll be talking a little bit more about this over the summer, but this is going to be our first year at the state fair. It's a really big step forward for us and an opportunity. And I hear from Senator Marty that there is a way to highlight when representatives are at our booth, spending some time. So we will invite you all, the caucus members especially, and leaders, to join us at some time during those 12 days, and then we can announce that you're there. Put that out there for you.
I'm going to take you up on your offer. I'm going to just go quietly into the background and
Okay,
read by your next topic,
Okay.
but I'll have to leave. I'll just leave quietly when I need to.
okay. Thank you so much again. So Dr. Brakke, would you like to go ahead and start talking to us about what is ACO REACH and why do we care?
I certainly do want to talk to you about this. Judy, there's a graph that I sent you. Can you put that up on the screen for a minute? There we go. So what you see is a graph of healthcare spending for most of the modern countries in the world, and the graph runs from 1980 to 2019. And what you see is that in 1980, although the United States was leading the pack, we were actually still more or less in the pack, and subsequently our spending on healthcare has grown much faster than spending on healthcare in these other countries. And the reason that I bring this up is that during these years, we have seen health maintenance organizations, that is HMOs. We have seen hospitals and clinics and insurance companies merging and developing greater market power and greater political influence. And we have seen accountable care organizations, or ACOs, created. And it's pretty obvious that none of these are being beneficial to the cost of healthcare in the United States. And as a matter of fact, a good argument can be made that in many ways they are detrimental to it. So Judy, could you pop up the next image? So a lot of people talk about privatizing medical care, Medicare, and this is not a misprint. I thought that in a lot of ways, privatizing doesn't do a good job of indicating the problems behind what's happening in Medicare with Medicare Advantage plans and now the accountable care organizations and ACO REACH. I think that we are continuing to move in the direction where we're allowing the profit-oriented pirates in our society to extract more and more money from the medical care system when it's not to the benefit of the patients. So Judy, you can take that image down now. Thank you. So I volunteered a couple of weeks ago to do a talk on ACO REACH, and I thought that this was going to be fairly straightforward. The first thing I'm going to comment on is ACO, of course, is Accountable Care Organization, and those have been around since about 2012. And the idea was that by having different aspects of the healthcare system work more closely together, that things could be done in an economically more efficient way, and we would also improve the results of the healthcare. The studies that have been done on the ACOs show generally no improvement or marginal improvement. So the newest accountable care organization iteration is this one called REACH. Somebody in the Medicare bureaucracy spent some time coming up with this acronym, which stands for Realizing Equity, Access, and Community Health. So REACH is, again, realizing equity, access, and community health. So the first problem with this program is that it is populating this program by sweeping up people who are in traditional Medicare, who stayed in traditional Medicare because they did not want to be involved in the managed care program, and now they're being stuffed into this managed care program called ACO REACH. My time to discuss ACO REACH is quite limited, so I apologize if I make some assumptions about what you know and do not know in order to avoid using all my time defining terms. When I volunteered to give this talk, I did not realize I would be challenged with so many pages of tedious description in Medicare documents, which are dense with contractions. The first document I pulled up on my computer had a list of 24 contractions at the beginning of the article. The second document I pulled up, in addition to having contractions, had a glossary, and there were 39 terms in the glossary that you needed to understand in order to be able to comprehend the document. It's a bit like learning a new language, and it's also a bit like volunteering to be the subject of a failed root canal. But I did learn a lot, and I'm going to try to pass some of that along to you this morning. I will be clear up front that my goal here is to have you contact your U.S. senators and your U.S. representative to express your wish to have them abolish the ACO REACH program, because it is not the right way to approach our U.S. healthcare crisis. So I'd like to list some of the basic problems in ACO REACH. First of all, the arbitrary assignment of people to ACOs. Secondly, the insertion of another profit-seeking entity into the payment chain, and we'll get to the payment issue a little later on. Third, adding more administrative complexity into a healthcare mess, which already has the highest administrative waste in the modern world. Also, encouraging the restriction of medical care in order to increase profit, and attempting to save money using a managed care concept, which has been shown to not be effective at either saving money or increasing the efficacy of medical care. And ACO REACH ignores the evil elephants in the room, and these are profiteering, excessive administrative overhead, and sky-high pharmaceutical prices. ACO REACH will simply make our medical mess, our non-system, worse than it currently is. Let's look at some of the assumptions that ACO REACH is based on. As I already pointed out, before ACOs were created, there were HMOs, but HMOs were sold using many of the same arguments which are used for selling accountable care organizations. The ACOs are based on a theory that better coordination of care combined with a system of rewards for saving dollars and penalties for spending too much will improve medical care while simultaneously lowering cost. One of the first assumptions in an ACO, in the concept behind ACOs, is that fee-for-service billing is more susceptible to abuse than is capitation. The experience with insurance company upcoding and the billions of dollars extra that Medicare has paid because of upcoding has shown that that paying based on capitation is just as susceptible to abuse as is fee for service. Think of it this way. Are the CEOs of insurance companies, pharmaceutical companies, and hospital chains less likely to attempt to take advantage of the government than a doctor charging via fee for service? Real world observation tells us this is not true. Most physicians' primary interest is caring for patients. Corporate CEOs' primary interest is maximizing revenue and profits. Okay, another assumption behind ACOs is that we can somehow find savings that can be achieved while at the same time improving patient care. The studies that have been done to date have shown the ACOs have failed on that score. A third assumption is that ACOs can negotiate better prices for their services. Now, on the face of it, this seems like a logical approach, but it's actually nonsense because the ACOs are generally relatively small compared to the size of the marketplace and compared to the size of the organizations they're trying to purchase services from. It is true the ACOs may be able to extract some dollars from the compensation for nurses, housekeepers, and physicians, but they are not big enough to have negotiating clout to get at the serious money which is pharmaceutical costs, inflated medical prices, and outrageous hospital costs. Then there is the issue of improving equity. I guess that that would be an entire different talk, but I think if you give it a little bit of thought, you will see that structuring ACOs and trying to encourage people to decrease spending on Medicare at the same time that they're reaching out to underserved communities doesn't inherently make much sense. I was quite intrigued when I ran across a part of the, I was reading a document called Request for Application. This is a 116-page document, which is designed for companies that want to become ACOs. And so it's a request for application, and it explains all of the things that you have to do to become an ACO. And in one of the sections, there is something about program integrity. So, you may ponder the question, will ACO reach ACOs be carefully overseen by Medicare? Well, I want to read you one section of the program integrity document. It says, and I quote, "To support the program integrity review, applicant ACOs will be required to disclose the following." And then a little later on, one of the things you have to report is any sanctions or corrective action plans imposed under Medicare, Medicaid, or state licensure authorities within the last 3 years. And also it says, any fraud investigations initiated, conducted, or resolved within the last 3 years. Now, do you feel reassured that everything will be fine if the CEO's last attempt at fraud was more than 3 years ago? Well, anyway, moving right along here. The next item I'd like to address is the diversion of your tax dollars. The ACOs are built around this notion that if the ACO can spend less money taking care of the patients that it's supposed to be taking care of, then it can share in the profits. And so you might ask, how much of those profits can an ACO extract? I think that we all agree that the goal of our Medicare dollars, or any dollars that we pay for medical insurance, are that as much money as possible should go to the actual medical care, and as little money as possible should disappear as corporate profit. The financial complications for ACO REACH are complex, and they can vary somewhat depending on which portion of the ACO REACH program the ACO participates in. But if you want to look at the most extreme case, when one does the calculations, it turns out that an ACO, if it was able to figure out how to not spend money on patient care, could walk away with over 38% of the dollars which are being capitated to the ACO. 38%. It just seems outrageous to me that anybody could imagine that you can extract 38% of the money from the program while at the same time you're improving the results of the medical care and you're decreasing inequities. Okay, let's look at another aspect here. Let's assume that there's a situation in which an ethical healthcare company, i.e. one of those hospital, clinic, transitional care, or nursing home operation, looks at ACO REACH and scratches their head as to whether they're going to participate. When one considers the trivial amounts that a few ACOs have been able to save, one might ask, why would an ethical health system bother? Well, you have to look at it from the CEO's perspective. If the capitation that the health system would capture adds up to millions of dollars extra that the ACO is reputedly managing for his healthcare system, and managing more revenue always means more compensation for the CEO. So even though this is a deeply flawed program, there are likely to be many people who will participate in it simply to be part of this revenue stream rather than letting somebody else have the potential to extract dollars from the Medicare system. I have a few concluding thoughts. First of all, ACO REACH cannot significantly impact any of the problems it is supposed to address. It forces Medicare patients into managed care without their consent. It puts more of Medicare into the control of those seeking to maximize profits from your tax dollars. It puts patients at risk of reduced care so that the ACOs can profit. And it's incapable of prudently achieving significant cost savings, and it is exceptionally unlikely to improve public health or reduce inequity. I would ask that you call, email, or write your U.S. representative and your senator's offices. If you call, you have two options. You can ask the staffer if his or her boss is on record opposing ACO REACH and see what they say. Or you can go straight at the target and tell them that ACO REACH should be opposed. In either case, just keep the message simple. The person you are talking to does not set policy, and making a long pitch to them is not useful. Be very courteous to the staffer. Make them like you and want to pass on your message. And maybe you'll make them curious and have them look into the ACO program themselves. Your next job is to get someone else to take action. And then I hope you will follow up with your legislators in a month or so and keep up the pressure, because without a lot of public pressure, this program is going to do great damage to Medicare. If you should find yourself compelled to learn more about ACO REACH, a couple of options are, first of all, the Medicare, i.e. CMS webpage, where you can search for ACO REACH and find all of the documents which are available on the subject. And secondly, a simpler option, which is to go to the PNHP webpage, which has both written material as well as a nice recent video on the subject of ACO REACH. So with that, as Porky Pig might say, that's all, folks, and I will turn the program back to our moderators. Thank you.
Thank you, Mark. That was excellent. Judy, did you see a commentary in the Q&A about one of the candidates discussed earlier?
Yeah, it's under answered now.
Okay.
So if you scroll to the bottom of answered, do you want me to read it?
Just for people's information, we
Yeah.
definitely do want to flip some of these seats to a friendly to Health and Human Services, but we have a participant who put in some concerns about that seat up in Senator Bach's seat.
Grant, are you talking about the one from Jerry Grant Hochschild?
Right.
Grant Hochschild may support the Minnesota Health Plan, but I question his support for ACO REACH. Essentia signs the letter for rebranding DCEs. This is from his LinkedIn page. Grant Hochschild, second degree connection, second executive director at Essentia Health Foundation and Hermantown City Councilor.
Mm-hmm.
Experienced fundraising, policy, and political professional, currently serving as the executive director of the Essentia Health Foundation, skilled in public policy, grassroots organizing, nonprofit fundraising, and volunteer management. Master's degree in public policy from the George Washington University.
I think just for our participants' knowledge, we would want to question him seriously about his support for single payer financing. Yeah, since he's kind of on the inside of the healthcare system, it sounds like. Anyway, and then Mary Lund's question for Mark is, does anyone know the fee ACO REACH received from Medicare? That's not exactly the financing mechanism for these companies. Mark, do you have any comment on that?
I'm sorry, I'm not sure. I definitely do not understand. What is the question?
The question is, does anyone know the fee that ACO REACH received from Medicare? It's not really a fee based. It's based. Go ahead, Mark.
No, they're not. They're given capitation. The ACOs are given capitation to take care of the patients, and then if they spend less than a particular target, they get to take some of the money that was saved and retain that for their operations. Or if they spend more than the target amount, then they owe money to Medicare. So it's a little bit like working on commission, in that you get a cut of the money that is spent if you spend less. Maybe it's kind of the reverse of working on commission, but the bottom line is that the system is set up so that if less money is spent, the ACO gets to keep some of that money, and Medicare gets to keep some of that money. And it's a system, you know, ACOs have been around now for 10 years. And if the ACO concept had the ability to reform healthcare delivery in a positive and effective way, we would know that now. Most of the ACOs have been totally ineffective. A few have saved some very small amounts of money, and there is evidence that some of them have actually been trying to extract money in various ways from the system, which are not in the interests of the patients.
Thank you so much. I am going to go ahead and start the last couple sections of our meeting with I'm going to share my screen right now, and we will go to announcements and volunteer opportunities. Let's see. Okay. We have a lot going on this summer now that we're back to some in-person events. We have some big events going on in the metro, and there are some outstate opportunities as well. The event that's coming up next where we could use some volunteers is we are tabling at the 2022 Twin Cities Pride Festival and in Loring Park in Minneapolis. And we do need some volunteers for that. You can volunteer by contacting me directly, and my contact information is in the slide set, or go to our website, hca-mn.org, and send an email, and we'll catch it. We've got 2 4-hour shifts a day, 10 a.m. to 2 p.m., 2 p.m. to 6 p.m. It is an amazing opportunity to meet with a lot of people in a really efficient way, especially a population who has some special healthcare needs, and a younger population who we do need to engage in this movement. So that's really important, and we're looking forward to it. They did hold that event last year in July. We tabled and we talked to over 600 people in 2 days. It's an incredible opportunity. So consider that. There are Mankato is tabling for a June 19th event around Juneteenth at the Civic Center Plaza. East Metro Healthcare for All Minnesota activists are tabling for Juneteenth in Woodbury, probably same weekend. And if you can help with an event coming up in Redwood Falls, Farm Fest is happening August 2nd to the 4th. Let us know as well if you're available for that. And I know that there will be farmers markets. Northfield is already doing some in-person events. Duluth is working on getting some in-person events coming up this summer. So stay tuned. We'll try to put some events on our calendar so that you'll know what's coming up. And our big one that we are really excited about is the State Fair, which is August 25th through September 5th. The 12 best days of summer and fall, right? We are really excited to announce that we are going to be staffing a booth at the State Fair this year for the first time ever in the Education Building. We have a great spot. We're going to be right across from the legislative booth, which is on the east side of the Education Building if you've been there. We have a corner spot. We are going to need a lot of volunteers for this event. So stay tuned for more announcements and messages on that. But we welcome anyone, if you're planning on going to the fair, or maybe this will get you to come to the fair. It's a great opportunity. We have to staff that booth from 9 a.m. to 8 p.m. every day for 12 days. We'll have 4-hour shifts and 6-hour shifts available, but we obviously can be flexible with people who are and your availability. Again, very excited. Great opportunity to talk to people from all over the state who we would there's no way we would be able to contact this many people from all around the state other than this venue, the state fair. So please consider joining us for
And
some part.
I just want to interrupt so that people who may be new to volunteering know that we can also pair you with somebody who's a little more
Absolutely.
experienced at volunteering. So don't feel scared that if you're not the most knowledgeable, you know, we'll help make sure that you're with somebody. So if you're nervous about that, just let us know.
Absolutely. We will have opportunities for training and also information available so that you don't have to remember everything that we might want to tell people. We just really want to introduce a lot of people to the idea that there is a fix for this mess, and here's what we're working on and how they can help us make it happen. But yes, we'll have our experienced resource person assigned to our booth every day, and we will pair new people with experienced people at tabling. So absolutely good point, Judy. So also please read and share our monthly newsletter. It just came out on the 1st. Also check our website. Judy's done a lot of updating. We try to have new articles posted on the website, thanks to Dave Garibaldi especially. Also check for legislative updates. The Minnesota Health Plan website is mnhealthplan.org. It'll be in the notes that come with the slides for you. Also loaded with some good information and a very extensive frequently asked questions section. I'm including here a few more websites. The More You Know, resources websites, places to go for good videos. Senator Marty's book, I always say, is a must read to understand this proposal. Also our website's on there, and then the new Minnesota Health Plan Caucus website is up. And as they have events planned, that they will be posting those on their website as well as us communicating it. And I also pitched the PNHP website, which is just really a wealth of incredibly good information. I will other websites for partners in this movement from all around the country. I'll just call your attention to Public Citizen, which has been a longtime supporter of this work. Labor Campaign for Single Payer, another important website, and Healthcare Now, important partners for us. And then the One Payer States, which we are part of as a state-based plan proponent. Mark explained why we need to protect Medicare, Mark, with an important call to action and really good tips to use when you are talking to your members of Congress or their staffers. So as this information is in our June 1st newsletter, and also it's a way to partner with Physicians for a National Health Program, who are leading the charge to keep members of Congress informed and also the public informed on what we believe is a danger to Medicare and our important single payer financing for seniors and the disabled, and also an important platform to go forward with single payer for all of us. So we would like to ask you to participate in this effort, and here are the numbers you can use, including Dr. Brakke's excellent tips for talking to members of Congress. So got the phone numbers you can use, 3 things we need to do. Also watch for activities around the birthday of Medicare and Medicaid, which is July 30th. A few extra talking points if you need them, and then some phone numbers. It's just as easy to call the Capitol switchboard, and we're also put the phone number for the White House in there. We need to ask President Biden to put a stop to this. So I think that's it for me. I'll turn this over to Judy, who's going to talk a little bit about social media engagement with our social media.
Great. Just one second while I pull up a quick slide.
Okay.
Okay. This is from Carolyn Hankey, who's our social media coordinator. Over the last year, our social media pages have grown by over 200% as we've been working on acquiring more followers using social media. We still need your help with this because there's still more growth that we can do. And the best thing that you guys can do to help us is to like us on Instagram, Facebook, LinkedIn, or Twitter. Also on YouTube. If we get to 100 followers on YouTube, we can have our own unique ID for our YouTube channel. So then it's easier to point people towards it. And I think we're at like somewhere close to 60. So if we get around 40 more, we can do that. And then you can just tell people, oh, go to their YouTube channel. It's youtube.com/healthcare for all Minnesota, or whatever we end up having it be. So like us, and then also share our posts. The way all of these sites work is the more your posts, the more you're liked, and the more your posts are shared and liked, the more people will see it. So the more often our posts are liked or shared, they show it to more people in the area. And so if you could do that, we would so much appreciate it. And to get to each of these sites, the best way you can do that is to go to our webpage, HCA-MN.org, and then just scroll to the bottom of that page. And at the bottom, you'll see each of these icons there. And those icons will take you directly to our social media sites, or our webpage, our page for that social media site. Thank you. And did you have any other comments before I close up the meeting?
I just would really encourage people to, Mark's suggestion of spend a few minutes a day, let's say 15 minutes a day, just moving around whichever sites you are willing to engage with. This is a really good way to reach people in an efficient, effective way. I think Carolyn's done an amazing job with creating posts that are interesting and engaging. So what we need everybody to do is share. Look, go in and look frequently for opportunities to share this information and grow your supporters and support for us as well. It's really one of the most cost-effective and efficient ways we have of making our presence known. You can go right now to Healthcare for All Minnesota's YouTube site and up that number for us. Healthcare for All Minnesota YouTube. If you are, anybody can go to YouTube just by putting it in your browser. Well, thank you very much for that. Carol has her hand up.
Yes, I am asking everybody to go to the donate site for this meeting and even give $5, because what we need to do is start looking at every meeting as an opportunity to network, educate, advocate, but also donate. So this shows support. Thank you. That's it. And thank you very much.
Carol.
I just did it.
Oh, now to that side. Okay, thanks. I'll let you wrap up, Judy. Thank you very much. Thanks to everybody who joined us this morning.
Sure. Yeah. Thank you everyone for joining us. There will be a follow-up email early next week with the slides. So don't worry if you didn't get down those phone numbers or websites that Ann shared. You will receive all of those next week, as well as the link to the recording of this webinar, so you can share it with other people who you think may be interested in the things that we discussed. In the meantime, I hope everyone enjoys their Saturday. I know the weather here where I live in Woodbury is absolutely beautiful, and I hope it is where you are as well. And so with that, I'm going to go ahead and end the meeting and let you all go enjoy the rest of your day. Thank you.